commonly tested topics, test taking strategies. These are IU facts. Now let's get to it. The next, provide teaching to a client scheduled for MRI in 24 hours. Which statement made by the client indicate need for further teaching? Buzzword, MRI. What is the issue? Further teaching. You know what an MRI is, right? You should not have any metallic substances. They put you in a place, it's a circular magnetic container where they can examine you for a very long time. They will inject some contrast. If you have any implant, any metallic substance, we have to remove it. We don't give you any oral contrast. I will have flush face with contrast injection. This is IV, yeah. Whenever they give you contrast, you may have a flush face. We can have an inner feeling of warmness. I need to check if my cochlear implant is MRI compatible. Yeah, we want to make sure it's MRI compatible so that we don't destroy it. I would drink a chalky substance before the procedure. No, this is not a barium study. So that's the right one. I should be able to drive home after the procedure. Yeah, we don't give you any sedation. So drinking chalky substance is barium. You don't need it. You don't need barium injection and oral injection. So that's the right answer. 3, further teaching. Next question. Select or apply. Which client situation require immediate phone call? And next, reviews phone call for the outpatient medicine clinic. Whose situation is bad? It's a prioritization. If you see something that is contraindicated, that's your right answer. And Aspirin for DVT. Okay, that's good. While you're taking ginkgo for memory, well, you're going to bleed. I need to intervene. Chlorothalidone for hypertension. You're taking Locurize for gastric ulcer. Well, chlorothalidone is for hypertension. It causes what? Hypokalemia. It's a diuretic, like hydrochlorothiazide. Locurize also causes hypokalemia. We have a problem. 2 hypokalemia cannot be together. BPH, refusing therapy. Okay, if you don't want to be treated, fine. But now taking what? Sawapamate. Yeah, Sawapamate is about treatment for BPH. I don't care about it if you want to use that. There's no medication that will interact. Cirrhosis with ascites, that means bad cirrhosis. But if you're taking black ash, that's a problem. These affect the liver. This is used for menopausal symptoms. So this is a problem. So we have to intervene. Diazepam for anxiety. Well, that's what it's used for. But if you take valerian root, this will potentiate the diazepam. You should not take anxiety medication, valerian root, if you're taking anxiety medication. So this one, I got to intervene. So 1, 2, 4, and 5 wrong answers. Those are the ones you get to intervene. They need immediate phone call. It's a select or apply. Number 3, a nurse provide teaching to a new graduate about asthma pharmacology, which drug the nurse should include in the teaching as not appropriate for acute management. I always try to, when I read a question, you see I emphasize when I read it, I get to a point. That's your key. Select or apply. Acute management, but what? Not appropriate. If you mix this word, you're going to get the answer wrong. Not appropriate for what? Acute management. And what is the problem? Asthma. So what is the medication? You can do this in 2 ways. What medication is used for acute? Whatever is left is your right answer. Or you just go directly to not acute. So test taking strategy, buzzword content. What is the ask? Not acute, right? And what is the buzzword? Not acute for asthma. Acute, right? Not acute for asthma management, right? Or not inappropriate for acute asthma management. Well, Abuduro is for acute. Montelukast is leukotriene, it's for long-term management. Theophylline is a long-term management. Ipratropine is what? For acute. Salmeterol, long-term, or long-acting, basically. So the right answer is what? It's not acute, appropriate for acute. Number 2, number 3, and number 5. Those are your right answers. Number 4, NS is assessing a client in oxycodone withdrawal. Which of the following symptoms the nurse should expect? This is a um, substance abuse problem, right? Keyword oxycodone withdrawal. Then you bring your content. Oxycodone is what? It's a downer. So you bring your symptoms down when you are what? Intoxicated. So when you take oxycodone, your symptoms is going to go down. You don't have to memorize the symptoms. I don't memorize them. When you withdraw, it's opposite. Symptoms goes up because it's a downer. Then you look at the answer choice. Who is going up? Tachycardia is going up. Dilated pupil, it's big. Your pupil is big, going up. Constipation, sound like you're going down. Yawning, up. And shallow breathing is going down. Therefore, these are the things you have to pay attention to when they give you these kind of substance abuse questions. Okay. Number 5, NS cares for a client with active TB. Which of the following is appropriate action when the client goes for his X-ray? I intentionally said it this way. I never give you anything, but I want you to use text-taking strategy. Nurse cares for what? Patient in active TB. That means patient has to be in the hospital. When patient in the hospital, active TB, they're in isolation. So they are in negative pressure room, right? When the client is in the room, they're not going to wear anything. But when they go get an X-ray, all they need is what? Surgical masks. They don't need any N95, anything like that. So the client wear N95. No, the client wears surgical mask. The client wear a gown. There's no need to wear a gown related to that. The client does not need face shield. Only thing he need is to have a surgical mask. So that's number 5. Number 6, and then because for a client prescribed high dose aspirin for cardiac stent. Which of the following herbal medication the nurse should educate the client about? So you take high dose aspirin because you have a stent. So which one should I worry about? Saw-palmetto is BPH, so I'm not worried about it. Garlic, ginseng, and the triple G's, right? These are the 3 G's. There can be 5 of them, right? These are all causes bleeding. And so you should not take, when you take aspirin, you should not take. St. John's wort is for depression. So 2, 3, and 4 are your right answer. And then it's ready to perform allergy skin testing on the client. Which priority action the nurse should take before the skin test? So this is very tricky question. So if you're going to have an allergy, this is your back. Always, most of the time, they do it on the back or the hand. Okay. So the nurse, the most important before I start is to mark the area I'm going to give the allergen. So maybe I put chocolate here. I put shellfish here. I put, all the allergy. So I mark it. Then I'll do the same copy on the paper so that I know, like that. Then copy so that when you have reaction, I can tell this is where you had a reaction this way. So that is the most important. All the things listed here is fine. Review details of the procedure. It's okay. It's not a priority. Review client allergy history. It's not a priority here. Ensure duplicate drawing of the application site on the paper. Yes, so that we know what is the most important. If I review all these histories and still I can't figure out what is causing the allergy, I may not be able to help you. So that's administer antihistamine. Antihistamine need to be stopped a couple of days, like 5 days or something like that. So that because if you take antihistamine, you will not react with the allergy. So that's the idea. So that's something I just put it out there. Number 8. This one too is test taking strategy and thinking. It's straightforward, but you have to think about it. This assesses a client with what? DVT in the emergency room who is taking what? Warfarin as outpatient. Okay. Which finding need priority action? So what it means is the nurse assesses the client, right? The client has DVT and he's taking warfarin. Which of those are you worried about? The INR of 3.5, is blood pressure this, or figurant emesis, or heart rate of 110. Test taking strategy. You take Coumadin, If for DVT and you're in an emergency room, your INR is high, your blood pressure is this, your coffee grounded, and your heart rate is that. Which one is dangerous? When you vomit, coffee ground emesis means you're bleeding. And you're vomiting, I need to protect airway. This is number one. Every time somebody comes in vomiting, airway is a priority. To protect the airway, otherwise they will aspirate. So that's the right answer. I know this is high, but this will take time to bring it down. This is not that bad. This is tell me you're bleeding. All these things tell me you're bleeding. So I need to protect your airway. Number nine, and this is also not that bad. It's straightforward, but you have to know how to do it. Calculate how much insulin the nurse should administer for a glucose of 200. Then there's an order. Administer 3 units of insulin plus sliding scale. Once again, straightforward question. So there's an order. Every time you something happen, you calculate the patient glucose, you check your finger stick, you're going to get 3 units anyway. Then you're going to add it to what you see on the sliding scale. The way to read sliding scale, you see the sugar on the other side and the insulin. All you need to do, if the sugar, look at the range. This is the same as heparin drip chart. 80, this one you don't have to think. You don't have to calculate, do fancy calculation. You say, if your sugar is between 80 or to 150, I don't give you any unit. If your sugar is 150 to 200, I give you 4 units. If it's 201 to 300, you get 6. And if it's 300 to 301 and 400, you get 8. And it's greater than 401, yeah. Or it's greater than 400, yeah, you can get 100 units, 10 units. So first, they say give the patient 3 units, no matter what the glucose is. So administer 3 units of insulin plus glucose. So for finger stick of 200, you're going to get a standing order 3 units, right? Then after you do the standing order for 3 units, now you look for the 200. Where does 200 fall? 200 fall here. That means I give you 4 units. So I add it to like what? 4 units. So the client is going to get a total of 7 units of insulin because 300 for 33 units for standard, that's 4 and 4 for the where it fell on the sliding scale, which is here 4 units because of 200. So that's why you get 7 units. And the last one, and then it's prepared to admit the client with hepatitis C infection. What infection control precaution is indicated? People always make the mistake about this. Okay, Hep C, Hep B, they are all standard precaution because they're sexually transmitted, right? So if you're sitting there, me taking care of you, there's no airborne, there's no droplets there. I'm not going to get infected from that. Unless there's a cut and I'm going to touch it, I have to be careful about it. But the infectious control protocol for hepatitis C, B is always standard precaution. So what we're going to check, standard. Take care of yourself. Thank you for subscribing to Adapting. Please enjoy. Have a good day. Bye-bye.